This is, remember we talked about what we're buying when we get health insurance, how we buy it, how the exchanges work, and when we buy it. So this is when people can get insurance, because a lot of people won't get it. They'll think they can just walk into a store any day and pick it up, and they can't. There's an enrollment period. And we're very lucky that the enrollment period starts in, 2 days? Is today? Yikes. It's exciting. So, and it's not going to end until March 31st. If you've had insurance through your employer, you know that enrollment period is typically in the fall, and then January 1st your insurance starts, and there's dates you get cut off, you know. But this enrollment period is going to last through spring. Two great things about that is that when people who already enrolled start getting their insurance in January and they tell somebody about it, and that'll be like the first time they heard about it. They won't have to wait till the end of the year to get insurance. So we've got this extra bump. The other thing, I'm going to give props to Brian Hale again, is a lot of people aren't going to be able to take on another bill until they see what their tax return is, you know, and they're going to go get their taxes done, and that's going to be another good time to think about this, see how much their return is, and then that tax accountant or whoever helps them might be able to say, you know, since you're doing this, why don't you estimate your 2014 income, and let's get you signed up for health care, and it's only going to be this much a month. Now personally, and this is another thing that had been suggested through the Tennessee Exchange, if we had that, is that we always keep enrollment open through the spring, so that we always have that ability to deal with that tax return situation, and with how this is linked into the IRS and tax filing. So anyway, that could happen someday. But for this year, we're going to go through March 31st. Annual open enrollment periods will start on October 15th through December 7th of each following year. So that's what they're looking at now. Insurance coverage begins January 1st, 2014. Now, a couple of questions people have asked, and I do think that this is important. It's a little detailed, but if you have enrolled before December 15th of 2013 this year, your insurance is effective January 1st. But if you enroll after the 15th, they're going to need some paperwork processing time. You know, it's only 2 weeks and everybody has to have Christmas, right? So if you enroll between the 1st and 15th day from January through March, again, it'll be the first day of the following month. But when you enroll in that second half of the month, you're not going to get in on the 1st. You're going to get in on the 1st of the following month. So it's a little bit of a rolling. And the 1st of the month is always when the insurance starts. Not 30 days later, not 2 weeks later, but the 1st. So we're going to have a little bit of a cycle. Well, not us so much, but navigators and people who are actually helping people with enrollment are going to have a little bit of a cycle where it's a push, push, push at the beginning of the month. And then at the end of the month, because they want to hit that deadline and get people in for the 1st of that next month, then at the end of the month. And what I would suggest to us is we continue to learn how we can reach out to people and learn. We have a lot to learn about how people doing outreach and people doing enrollment are going to work together to magnify our impact and to be efficient. And I would suggest that you look at scheduling your events when you might want to have help from a navigator. You might want to make phone calls for that end of the month period and give them a little bit of a break as they're trying to enroll people and hit that deadline at the beginning of the month. It's not going to be important this fall, really. I've just kind of been thinking ahead. So we just have a lot to do, and the more that we can understand how other people's jobs work, the better we'll be able to do at ours. So any questions about those? Rolling? Special enrollment periods. I think Mary alluded to this earlier. If something happens that changes your needs for health care outside of enrollment period, you'll be able to enroll. So if you gain a dependent, you have a baby, and you've got to add that person to your plan, or you weren't in the plan, now you've decided you want your whole family to get covered, there you go. Gaining a lawful presence. If your paperwork on becoming a documented person comes through, that's a reason. Enrollment errors of the marketplace. You know, unlike George Bush, we know that everybody makes a mistake once in a while, right? So if something happens with the marketplace and your original application didn't go through, they're not going to make you wait until the next enrollment period. Gaining or losing eligibility for premium tax credits or cost sharing reductions. So if you're in one of those places where you just you were under 400% and now you're going to be over 400%, or if you're at one of those other thresholds where your co-pays might get more help, and something about your previous situation caused you not to sign up, but now that you have a new eligibility for a new amount of help, now you do want to sign up, they're going to let you. Relocation resulting in a new or different health plan selection. This is pretty obvious to those of us who've had health insurance, but not so much to folks who haven't. You know, when you pick a plan, that plan works for this area. That's where the doctors are. That's where the hospitals are. That's where the plan is. If you move from Memphis to Knoxville, you re-enroll in a plan that works for that area. A lot of people just won't even, they're going to think, I just walk into whatever hospital I want to, I walk into whatever place I want to. So this is going to allow people, it's going to help people to know, I need to re-enroll in a different plan. Or if I've moved someplace and now I decide I wasn't even enrolled before, I now can enroll. So it's just another opportunity to get people in the program. And then exceptional circumstances. Who knows what those could be? They would be exceptional. Right, something. Yeah. So,
but not
Mary?
Having a catastrophic
No.
accident on April Fool's Day. That won't count.
Right. Not your house burnt down, now you decide you want fire insurance. Not that exceptional circumstance, but yeah, something else. And so how to apply. One application per family via computer, telephone, in-person assistant, or mail application with documentation. So I have ordered applications. I pre-ordered them through CMS. I don't have them yet. I'm going to give them to a navigator as soon as I get them because I am not enrolling people, right? So, but I'm going to look at them first. And what you're going to need to enroll is your tax returns are going to help you out, your W-2 forms, so you can make a good estimate. Check stubs will help you out. If you're self-employment, if you have a work journal, your income and your expenses, and everyone's Social Security number for whom you are applying. Now, how many people have heard about this whole Social Security number thing? Oh, Social Security numbers. If you give me your Social Security number, I could totally scam you like in every possible way just from having your Social Security number. And that's pretty much the only reason why anyone wants to help anyone with healthcare enrollment is so we can get all your Social Security numbers. Yeah. So here's another reason why you don't want to get in depth during your outreach attempts about how much money somebody makes specifically, what their Social Security number is. How, let them give you the information that they want to give while you give them the information you want to give about how helpful this is for them and their families, okay? Because it's true, there are people out there, we talked before about the insurance brokers and different insurance plans and things. There are people who will work any angle to take advantage of something. Now, the fact is that this is a life and death situation for people to get health insurance, and that's why we're in it. But there could be people who are in it for something else, and people are concerned about that. And then other people use that fear and leverage it to sow distrust and paranoia, frankly, about the Affordable Health Care Act, about this program. Ma'am?
Okay, the definition of family.
Mm-hmm.
Would it be two men that live together as a family or unmarried people?
Think about the tax returns. Think about the tax returns. The federal government has said that people who are legally married can file joint tax returns no matter what state they live in. So if a couple goes and gets legally married in Massachusetts, comes back here in Tennessee, they both happen to be male, they both happen to be female, doesn't matter. That's a family. I would assume because, and I say I am assuming, because this is a federally facilitated exchange and because we are looking at taxable income, adjusted gross income, that if the IRS is letting them file their taxes together, they would apply together as a family if they choose to. Jack?
They've ruled on it.
Yeah, they've ruled. So I'm not assuming. Mary Hedrick says it's fact.
You do go by the state law, and in Tennessee, common law marriage is not recognized, whether it's male-female or male-male or whatever. The only way you can get recognized as being in a common law marriage is if you're in a common law marriage in another state, say Arkansas, and you move to Tennessee, then you get to keep it.
Very interesting.
You can live with your partner in Tennessee for 40 years.
This is a
will not be
federally
recognized.
administrated exchange instead of subsidies. We're following the federal definition of
Yeah.
household for this
Yeah.
federal program.
Right. So if people are, if there's a state law about common law marriage, I don't know that that's going to apply to people in this case because,
If you follow the tax law, it will.
well, if people aren't legally married in Tennessee, then they don't file their taxes together. Except for in the case of people who've been legally married in another state and come here and then are recognized by the federal government for tax purposes. So, yeah. Eligibility, very broad eligibility. Live in the insurance service area in which you attempt to enroll. Makes sense. You don't want to have to go to Florida to go to a doctor. You can't do that. You're a U.S. citizen or national that's lawfully present in the U.S. You're not incarcerated. And then other eligibility would be determined through electronic data checks with the IRS, the SSA, the Department of Homeland Security, and other data sources. So yes, they are verifying things. They are making sure that people are able to get this insurance.